Hello everyone, this is Kaps here from the N-World Review. Today we will talk about the next topic, which is about the restraint. So restraint is a chemical, physical, or environmental means of controlling an individual's behavior or an action, as we all know. But a least restraint approach is recommended just to ensure the high quality care. And this approach ensures that all alternatives interventions are attempted before moving to the use of the restraints. And remember, in the restraint, informed consent from the family members that may also be required before we decided to use the restraints. So that was a little bit information about generally about the restraints, like what is restraint and why do we need it. Now let's talk about some of the alternatives to the restraint. As you can see the back of my screen. I only put the 5 points in here, but just so you know, there are the more alternatives option which we can do it as well. So I'll try to maybe cover some more alternative options at the very end, but let's talk about the first one at my back. So the first one talk about the orientation of the client and the families to the environment, explain all the procedures and the treatment, which means it's always a good idea to orient the client frequently, or maybe the family member, because sometimes we thought the patient is confused, so let's just do the restraint on the floor. But before we go for the restraint, it's a good idea if we try to make sure that the person know everything about it and do not feel confused about it on the floor. After the orientation, we can also make sure some of the companionship can be provided, or maybe some supervision approach, maybe have a staff with the client just to stay with them for a while, just to make sure they are okay and they don't need to require the use of the restraint, right? The third one, which I have at the back, is about the use of the diversionary activities, which means if any of your client like to listen to music, or they like to do something like a painting or a puzzle game or anything which makes the client will be interested to do something throughout the day. So that will be always recommended to use as a part of the alternative to restraints as well. And the fourth one is about assign the confused or disoriented clients to the room that are near the nursing station, as you can see at the back, right? I'm just trying to tell things so I can just show it to you. So why this is important as another nursing intervention, because before you want to try something as a physical or maybe a chemical medication, you want to make sure you do something first as a nurse before you try the least restraint approach, like the policy, which we don't want the client to do it for the client, but sometimes we might need it, but make sure you try these steps first before you try the restraint for the client. And the last point at my back, it says about the use the calm and the simple statements as well with the client while you're communicating with the client as well. This is another important point, because sometimes if we don't talk in a calm manner or approach, that makes a person aggressive. Or maybe it's a confused client, an older patient, and if the patient doesn't understand anything about what are we conveying as a nurses to them, that makes a person further frustrated and irritated and just start with the behaviors, right? So these are the common ones, the one I highlighted as a pamphlet. Now maybe I'll talk over more about some of the other the alternatives what we can use, right? So the other points what I have is with me is about if one of your client is having an aggressive behavior, make sure you use the de-escalation techniques and the timeouts if it's possible, just to manage the aggressive behaviors. And sometimes providing the visual or the auditory stimuli, that could also be helpful, because sometimes they're just missing the family. Maybe it's a new site for them and they're not maybe comfortable to stay in there, and that starts with the behavior. So if you try to show them the family pictures, that could be helpful, right? And apart from that, maybe make sure your client is having the enough the adequate hydration as well, the nutrition level is okay, and they're also getting a good sleep as well. And and the last part maybe I'll talk about is just make sure the other physical needs like toileting, the fluids requirement, like you just make sure you do listen the client concern, because sometimes we don't know what actually the client needs it, and that just aggravate the behavior, right? So I hope these little points could be helpful in understanding the restraint topic and what alternatives we can try as a nurses as well before we try the actual physical or chemical or environmental restraint. If this is helpful for you, please don't forget to like this video, and also feel free to comment below if you do have any questions for me, and don't forget to share maybe with your friends. Thank you so much. Have a great day.